Hello, beautiful students. Good morning. So good to reach you through this medium once more. And you're highly welcome to your best class, the basic science class, the highly objective class, the highly pragmatic class, where samples are tested and principles are proved. And this is not where mythical stories are narrated, but where things are done in such a way that you can even prove it by yourself in wherever you are at any part of the world. And so that is the best class you can ever be in, and that is the basic science class. You're welcome. For today, we're going to be treating the topic nutrition and diseases, and we're going to narrow it down with the subtopic nutritional deficiencies and effects. In our previous class, to recap, we treated the topic nutrition. Today we are going to do justice to the diseases that accompany deficiencies of certain nutrients in the human body. And I want you to pay particular attention to everything that you're going to hear from this class, because you will be seeing a lot of defects caused by deficiency of certain nutrients, which before now you might have been taking so lightly, but you have to be very, very careful. For the effects of the deficiency of some of these components of a balanced diet can be very, very fatal, as you can see while we go on. Make sure you have your writing material as well to jot down some basic points as we go on. Now, I said that our subtopic is nutritional deficiencies and effects. Our specific objectives, at the end of this lesson, I should be able to define nutritional deficiencies and effects, state some nutritional deficiencies and diseases, mention the treatment and preventive measures for nutritional deficiencies. Based on my research work concerning these, I want you to know that it is not possible, based on our time frame, to finish all of this, and therefore I am not going to rush it. I'm not going to summarize it. I will take you through each one of these deficiencies and their effects. So if we don't finish it, like I said, and I know we're not going to finish it now, we are going to finish it in our subsequent class. So be patient with me and let's get on with this class immediately. Let's go on to the first slide, where we have, in our page, we have the definition of our subtopic. What are nutritional deficiencies? Nutritional deficiencies are the absence or the lack of the basic components of balanced diet in the body of a living thing. Nutritional deficiencies are the absence or the lack of basic components of a balanced diet in the body of a living thing. When a meal that is being taken by a human being is lacking 1, 2, 3, 4, or even 5 of the basic components of balanced diet, then it is known as nutritional deficiencies. When it is lacking 1, it is a nutritional deficiency. If it's lacking 2, like I said, then all those are nutritional deficiencies, and they have their effects. When it is repeatedly done, the effect can be fatal, as we're going to see. Now, when any of the 6 classes of food are in short supply in the human body, it creates gap in the metabolic activities of the body, which ultimately results to some recognizable diseases in the human body. Now, I think I mentioned something about this metabolism in our previous class. What is metabolism? Metabolism is cellular activities, those things that go on within a cell that makes a cell to be living, the entire characteristics of a living cell, which I told you in our previous class that they are 10 and can be in short form of Mr. Niger card, where you have movement, nutrition, respiration, reproduction, growth, excretion, adaptation, and the rest of them. Now, all those activities, they go on inside the living cell and they are known as metabolism. So, when any of the 6 classes of food are in short supply in the human body, it creates gap in those metabolic activities. And when those gaps are created, automatically the cells are going to suffer some recognizable diseases in the body. Now, let's talk about what is a disease. What is a disease? A disease can be defined as the abnormal condition in the metabolic activities of the body. The abnormal condition, the condition that is not suitable for a living cell. And that is why we say it is the abnormal condition in the metabolic activities of the body. That is the definition of a disease. This abnormal condition can be caused by pathogens or non-pathogenic agents. Now, what is a pathogen? For some of you that might be wondering what we are driving at when we say pathogen. Pathogens are disease-causing organisms. Those organisms that can cause diseases. And I hope you are aware of some of them. The current one that the whole world is suffering from is a pathogenic influence, which is called the COVID-19, caused by the virus. A virus is responsible for COVID-19 that has caused the lockdown all over the world. And that virus called coronavirus is a pathogen, is an example of a pathogen. Now, we have other pathogens like bacteria, fungi, nematodes, and some protists. There are other ones. That is not our focus for today. Let's go back to what we are talking about. Now, this abnormal condition can be caused by pathogens, I've mentioned the examples, and non-pathogenic agents. Yes, it's not only living things that are parasitic in nature that can cause diseases. There are other non-living things that can also cause some diseases. These include nutritional deficiencies. When you lack some of these nutrients in the body out of those 6 classes of food, then it can result to a disease or group of diseases, as the case may be. Now, other non-pathogenic agents that can cause diseases include genetic disorders. Genetic disorders. Now, as we go on concerning the nutritional deficiencies that can cause diseases, let's look at the few ones we can tackle for now and for today. Among these nutritional deficiencies, you have when somebody is lacking vitamin, what will the person be suffering from? When somebody is lacking protein, what will the person be suffering from? Carbohydrate and the rest. Now we're going to start with the vitamins. The vitamins, according to the word vitamins, it means that there are so many types of vitamins. The vitamin complex, where you have vitamin A, vitamin B. In vitamin B, you have other sub-vitamin types of vitamin Bs. You have vitamin B1, B2, B3, up to 12. So there are so many types, or what I could call classes of vitamin B complex. So we are going to select some of those vitamins because we cannot elucidate every of these vitamins in this our class. We're going to be selective. Let's select some of them and then treat them so that you can have an idea of what the deficiencies can be like in the human body. Now we're going to start with the first vitamin, which is vitamin A. We're going to be treating vitamin A. And vitamin A, when there is deficiency of vitamin A, when it is lacking in the meal that a human being is consuming, These are some of the things it can cause. It can cause what is known as night blindness. What is night blindness? Night blindness is a condition in which somebody is not able to see very well under a dim light. So the person can only see where there is bright light. That condition is known as night blindness. And then another thing it can cause is epithelial tissue damage. The epithelial tissue damage. What are epithelial tissues? Epithelial tissues are those tissues that line up our organs. For instance, as you go into the human system, body system, for instance, like the respiratory system, when you get into the mouth, which is still part of it, or the nasal passage, or the air pipe called the trachea, you find out that there are linings inside the air pipe. There are coverings of the air pipe that line up the internal portions of the air pipe. That tissue that lines it up is called an epithelial tissue. Also, within the nasal passage, you have epithelial tissues that are mucous secretory in function. Now, those epithelial tissues and the other ones inside the body, even of the rest of the digestive system, they are epithelial tissues. They can be affected by the lack of vitamin A, which will make it to look dry when they're supposed to be a little bit moist and a little bit wet for easy passage and dissolution of gases that are taken into the respiratory system. But when this vitamin A is not in place, these epithelial tissues will now become dry. Now, something that aids the dissolution of oxygen, when it becomes dry, then it's very difficult for oxygen to be dissolved in that air pipe. Also in the nasal passage. Now, not only does it affect the internal epithelial tissues, it also affects that of external epithelial tissues. For instance, the cornea. The cornea is the white part of the eye, and there is a membrane that covers it, of course. But when there is lack of vitamin A, the cornea becomes dry and looks as if it is cracked in some regions of it, and that does not help the eye in vision ability. It will impair the person's ability to see properly. Now, in severe cases, as you can see on your screen, in severe cases, it can lead to total blindness. When there is severe lack of vitamin A, for a very long time, it can lead to total blindness. And I want you to know that when these things happen, there are a lot of complications that can be brought about by lack of vitamin A. If the epithelial tissues of the internal part of the digestive system are hampered, then assimilation of digested food will be very, very difficult, and the person stands in danger of being highly malnourished, which can result to other diseases. Now, in the next slide, I want to be showing you some symptoms of this lack of vitamin A, as you can see on your screen. And that is how it affects the eye. As it affects the eye, if you look on your screen, you can see that this particular eye of a patient suffering from lack of vitamin A, this area, you find out that it is somehow with a lot of cracks on it and dry in appearance. This person automatically will be having problem in seeing things correctly because the cornea is no longer as moist as it's supposed to be and fresh as it's supposed to be. Here you can see other symptomatic picture of lack of vitamin A, and these eyes are no longer normal and healthy eyes. A lot of blockages are already accumulating at cornea of the eye. And like I told you, if this condition continues for a very long time, it can lead to total blindness. Remember, what are the causes of all these things? Lack of vitamin A. So vitamin A is very, very important in the meal that we take. And what are the sources of this vitamin A? If we have to look for it and add it in part of the meal that we consume on daily basis. Now, you can source vitamin A from food substances like butter. The butter you use in eating your bread and taking your tea. The butter you use in making a lot of snacks that you consume. So butter contains a lot of vitamin A. Cheese as well. Cheese has a lot of vitamin A. So you can get vitamin A from these food materials, all right? And in so many other food items. Even in palm oil, you can also derive vitamin A, the red palm oil. And that reminds me, please, some of you that fry your oil, your palm oil, and remove the reddish part of it, you are also removing a lot of nutrients, which include vitamins. So it is not advisable for you to fry your palm oil before using it for anything, because you're removing the nutritional value. Okay, so it has a lot of, the deficiency of vitamin A has a lot of defects in the body. Remember, it causes night blindness and damage of epithelial tissues, and long condition of this will also lead to total blindness. And I know you don't want to be blind, so make sure you take a lot of vitamin A sources in your food on daily basis. Now, let's go forward. When it comes to vitamin B, there are different types of vitamin B complex. But we're going to start with vitamin B1. Now, vitamin B1, when it lacks in the meal that a human being consumes, is going to cause a disease called BERI-BERI. BERI-BERI is a disease of vitamin B1 deficiency. And what are the symptoms when vitamin B1 is not in place in the human body? The symptoms of this deficiency include loss of appetite. Loss of appetite. The person will not have the desire to eat food. He will lose appetite. The next one, there will be fatigue. And what is fatigue? The person will be feeling tired all the time. He's always tired. He doesn't have strength to do things. I want to tell you that the deficiency of vitamin B1 is very, very fatal. It can lead to death, as you're going to see in the symptoms. When it becomes severe, it can lead to death. Now, let's continue to mention some of these symptoms. I've mentioned fatigue. The next one is indigestion. It causes indigestion, which means the inability of the digestive system or the alimentary canal to break down the food someone had already eaten. My dear, is a very serious problem. If you cannot digest properly, then your body will begin to lose weight. The next one is poor assimilation of food. Even if your food digests by any means, the ability to take up that digested food nutrient into the bloodstream and into the cells of the body becomes highly impossible as a result of deficiency of vitamin B1. There is also what is called muscle wastage. Muscle wastage. The muscular tissues begin to degrade. They begin to lose their ability to contract and to retract. And you can imagine when somebody's body muscles have begun to degrade, the person will not be able to make necessary movements like walking, running, even sitting down properly, doing other things, picking items, doing some house chores. It will be highly impossible when the muscles begin to degrade as a result of lack of vitamin B1. Muscle wastage. We are going to be seeing a picture of a patient, a man that is suffering from a lack of vitamin B1. You will have pity for this man. And I will know that you don't want to be like this. Therefore, make sure that vitamin B1 sources are in your food on daily basis. If possible, I would want you and your mommy to listen to this class video so that she can be aware of the necessity of vitamin B complex in the food that you eat. If you don't see it there, please, you have the right, the human right, to tell whosoever has served you the food to please add vitamin B1 complex in the food. The sources must be there. The other symptom, as we go on, loss of weight. The person will begin to lose weight. When somebody is no longer digesting food very well and assimilating digested food nutrient into the blood, the next thing is that the person will begin to lose weight. The person is on the pathway to his or her grave. God forbid. But if you don't take care, these are the symptoms. Now, in the next one, in severe cases, it can lead to paralysis. It's a serious issue. It can lead to what? Paralysis and even death. Let's take a look at a man, a patient that is suffering from BERI-BERI disease. Look at this man. He can no longer walk. He's already moving with crutches. To tell you that he has reached the critical stage of the deficiency of BERI-BERI. The joints can no longer, in fact, if you look at him, he has lost weight. He can no longer stand on his legs because the muscles had been wasted. And at this level, it is very, very difficult to retrace backwards. So be careful and make sure that vitamin B1 is always available in your meal. The next vitamin B complex that we are going to check on is vitamin B3. Vitamin B3, another important vitamin necessary in the human body. And this vitamin B3, the deficiency is called pellagra. Pellagra is a disease that has the following symptoms. The symptoms include redness of the skin and tongue, soreness of the mouth. You can imagine when you have sores inside your mouth, if you're lacking vitamin B3, you can't even eat anything because any little thing you put inside your mouth is going to be very, very painful. Now, soreness of the mouth is there. Diarrhea. What is diarrhea? Frequent stooling. The person will be going to toilet almost frequently with watery stooling. And there will be fatigue associated to this diarrhea as a result of lack of vitamin B3. Now, the next thing is nervous disorder. What is nervous disorder? The nervous system will begin to malfunction. They will no longer coordinate very well in order for the person to be able to respond to stimulus or changes in the environment. And it can also lead to mental illness. So lack of vitamin B3 can have all these symptoms. Let's take a look to some of the symptoms here. Remember we said about the skin that there is redness of the skin and tongue. If you can see the pictures on your screen, the hand of this particular patient, you can see how it is reddish in color, most because it's a white person, and then the body is scaling off too. The entire skin, they are scaling off. And this little child here, although the picture is in black and white, the child has the same reddish appearance on his skin. Not just on the face, but also on his hands. Now look at this next slide. On the leg of one of the patients, you can see a lot of reddish appearance and scale-like formations which deform the skin, which makes the skin to look unappealing and very, very irritating. Now look at the hand of this man as well. Another patient that is suffering from lack of vitamin B3, which is pellagra, and then this one appearing on the feet. So this is how the skin is going to appear when somebody is lacking vitamin B3. Now let's go to the next one, vitamin B12. When somebody is lacking vitamin B12, it leads to what is called pernicious anemia. Pernicious anemia. As you can see on your screen, anemia means loss of blood. And when you add the word pernicious anemia, it means the loss of blood that is in quick succession, that is very fast, that does not give the person time to recover. It takes the person unawares. And you know the importance of blood in the human body. If you can mention some of them, I should be able to help you out in this regard too. Remember that the blood carries oxygen around the body through the red blood cells. Remember also that blood helps us to defend our body against diseases, and where you have the white blood cells, the soldiers of the body. And also in the blood, we have what helps blood clotting when somebody has an injury. Now you can imagine when all these components are in short supply, what will happen? Low oxygen supply, low immune system, and low ability to clot when there is injury, whether internal or external. And so these are some of the results of pernicious anemia. Now let's see a few of the symptoms of this pernicious anemia. Number one, you can see that it can result to what is known as organ damage. Another fatal disease, organ damage. What type of organ can be damaged when there is pernicious anemia? The heart can be damaged, the brain, the lungs, when somebody is lacking vitamin B12. If the brain lacks oxygen for up to 5-7 minutes or more than that, it can lead to brain damage. How much more when it is losing those oxygen supply bit by bit? It can lead to nervous disorientation. Now the next one is digestive problems. The person will have indigestion and some other problems associated with digestion processes. The person can also have what is known as memory loss. You will not be able to recount events or issues or things that have happened in the past, or things that he had been in the knowledge of in the past. He will not be able to recount them as a result of vitamin B12. And as a student you know it's very, very important that you have vitamin B12 in your meal, so that you can always remember what your teacher is teaching you in the class. So vitamin B12 is very, very important. And the next one I want you to look at is lack of vitamin C. Lack of vitamin C, and you know that we get vitamin C in things like oranges and the likes, the lime and the rest of them, the ascorbic acid. Now when somebody is lacking vitamin C, the effect is called scurvy. Scurvy. What are the symptoms of scurvy? The symptoms include loosening of the teeth. Loosening, the teeth becomes loose. Any little pressure on the teeth, it will make them to fall off because they are very weak as a result of lack of vitamin C. Not only will the teeth be weak, another thing that will happen is that there will be swelling of the gums. The gums into which the teeth are inserted, they will become swollen and painful. We are going to be seeing that in our next slide, but let's finish with the symptoms. Swelling of the joints. The joints of the body, both the elbow joint, the joints at the leg region and the hand region, and every other part of the body where you have joint, they are going to swell up, full of pain. And you can bear witness that for this particular patient that will be suffering from this, it will be difficult for the person to move around as a result of lack of vitamin C. Hemorrhages of the skin. The hemorrhages of the skin and mucous membrane. The person, without any accident occurring, all of a sudden will start bleeding in some internal parts of the body. For instance, from the nose, the person might start bleeding. Even in some other areas in the respiratory tract, both in the trachea, the air pipe, and the rest of them, there can be some internal bleeding that can occur. As we are going to see in some of these slides, look at this slide on your screen. You know, we mentioned the first one, loosening of the teeth, swelling of the gum. As you can see on your screen, you can see that this patient's gum, the gums are well swollen, and they will be very painful for this patient to put things into his mouth, even to chew or to swallow. And it will make the dentition appearance to look so awkward and out of place. So this is as a result of lack of vitamin C. And also, as you can see on this patient too, you can see that this patient is already having some bleeding on the gums. Look at this teeth at the lower jaw. You can see the blood coming out gradually from the lower jaw on the tooth as the gum begins to swell up. So these are some of the symptoms. Let's see some other symptoms of scurvy. You see, as a result of the teeth loosening, the person, if not treated immediately and in a proper way, will begin to lose some of his teeth. You can see in this person already, he has had a lot of teeth damages here and there. Okay, almost 3 teeth are now remaining in the mouth. The rest have been damaged as a result of lack of vitamin C. Now look at the next patient. The next patient is losing blood from the nostrils. The mucous membrane inside the nasal passage have started losing blood. There are breakages of blood vessels, and blood will start gushing out as a result of lack of vitamin C, which causes what is known as scurvy. All right, let's go to lack of mineral salts. I think for the ones we've just treated, these are the much we can take from the vitamin B complex. I just had to take about 3 or 4 of them to explain because there are so many other ones. Now, the next one is lack of mineral salts, and the mineral we're going to be looking at today is iodine. Where can we get iodine? Iodine is present in our common table salt, the salt we use in cooking. And iodine is very, very important in the functioning of the thyroid gland. The thyroid gland is a gland that is inside our neck region, which helps us to metabolize carbohydrate for growth and other protein materials. The carbohydrate will supply the energy, the protein material will supply the raw material with which we'll grow and increase in size and weight. And so when iodine is lacking in the body, the first gland and organ to suffer is the thyroid gland. And when it is in low supply, it will cause what is known as hyperplastic goiter. The hyperplastic goiter is caused as a result of lack of iodine in our diet. Now, these are some of the symptoms. Number 1, swollen thyroid gland. I don't know if you have seen some people that in front of their neck region here, they have swollen neck protruding out of the lower base of their neck. That thing is called goiter. Although there are different types of goiter, but the one I'm talking about is hyperplastic goiter. So there is going to be swollen thyroid gland. That is that swell up you will see on the person's neck. Then the next one, increased heart rate. The person will have a heartbeat that is abnormal in its beatings. Now you have nervousness. The person will be unnecessarily nervous, even when there are no situations to make the person to be nervous. Then there will be hypermetabolism. There will be an increased activity of the cells. There will also be high blood pressure as a result of absence of iodine in the meal. Don't underrate the salt that you use in your meals. When your mom is cooking for you, she normally puts salt. It's not just for taste. It also supplies one of these minerals called iodine, which helps your thyroid gland to work very, very well. Let's look at the pictures that show some of these symptoms on patients that are suffering from lack of iodine. Now, when somebody, this is the hyperplastic goiter on this patient. The neck is swollen in front. Now, for this particular patient here, you can see that her own has grown so big. And if care is not taken, it can block so many other activities in the body. All right? These are hyperplastic goiter patients. Their necks are swollen. So this is one of the basic symptoms you will use in noticing somebody who is lacking iodine. All right. The next one I want to talk about is lack of protein. Protein is very, very vital. In our previous class, you learned that protein is necessary for bodybuilding and repair of worn-out tissues. Now, when somebody is lacking protein, it causes a disease called kwashiorkor. Kwashiorkor is a terrible disease which affects almost everything in the body. It's terrible. As you can see the little child diagram on your screen that I pasted there, all the symptoms that could possibly come out from kwashiorkor disease are already labeled on the body of this patient who is a small child. You can see that in the pictures, you can see there in the diagram that there is a lot of changes in the skin and hair color. The hair color will begin to take a different color apart from the natural one. All right? Not necessarily being pink or purple as you can see on your screen, but this is for the white colored people. But when you have it on a black child or on a black patient, it's going to be a different coloration away from the normal. Now, there's also going to be wastage of the muscles of the child. The child will look so lean. So one of the symptoms is muscle wastage and loss of weight. The tummy is going to protrude outward. While the rest of the body are slim, you'll find out that the tummy is protruded, is enlarged, it comes outward, making the child to look so disfigured. And the head will look so big, the tummy will protrude, the rest of the body, the hands and the leg will look so slim. Now, it's as a result of muscle wastage and a lot of fats in the liver. There will be a lot of deposition of fats in the liver. There will also be shortage of blood. The ankles of the child are going to be swollen. If you look at that child with tiny legs, the ankle area will be swollen and be looking so abnormal and so irritating to the sight. So these are some of the symptoms of kwashiorkor. You can see the rest of the symptoms there. I told you it is a disease caused by lack of protein and can affect the entire body. It weakens the child. It makes the child to be in constant fatigue. So protein is very, very important. And I hope you know the sources of protein in your diet. There are so many of them. Don't miss any of these proteinous substances like meat, like eggs, fishes, and the rest of them, even in some cereals and some legumes, there are a lot of proteins in them. All right? So please make sure that you take balanced diet every time that you eat on daily basis to avoid all these deficiencies. Now, because of time, I will want to give you assignment at this juncture. And what is the assignment? Mention the effect of carbohydrate and water deficiencies in the meal. When there is no carbohydrate, when there is no water there, what will be the effect? And I want you to write out, just state them out. If there are 4, if there are 5, write them out and post on the Google Classroom. I want to thank you so much for paying attention to this class, and I hope you've learned enough that can change your life and the life of people around you. Thank you so much, and have a wonderful time.